Hello everyone, it is week 3, and this is the week that we're going to start actually kind of combining weeks. So last week we dealt with the urinalysis and blood collection. This week we're really dealing with microscopes and microscopic urinalysis along with pregnancy testing. So you'll see on Angel that it says that you have chapters 2, 3, and 7. Now you've already read 2 and 3, so it's kind of just a review of those chapters and kind of looking back over them and kind of reflecting back, because some of our labs this week will actually deal with those 2 chapters, and you'll actually have to read chapter 7. That's going to be a new chapter for you guys. So let's start with talking about microscopes this week. So I'm sure at some point in time you have all used a microscope. I mean, we've all probably been through high school and had a science teacher who was very much so about their microscopes, or you've used them in past classes. Especially if you've taken, I believe it's A and P, you get to play with the microscopes. So you guys know how to use them, but what you may not know is the 3 functional units of them. So the first functional structure of a microscope is really its foundational one. That consists of the arm, the base, and the stage of a microscope. Then you have your illuminating structures, which are your light sources and your condensers. And then the final structure is really your magnifying structure. So it's got your objective lenses, your ocular lenses, and your focus adjustments. The important piece with the magnifying structure is knowing how to read that, because you've got 2 different powers that you have to read from and be able to multiply them, so you know at what magnification you're actually looking at a substance. The other important piece is how do you clean the lenses, because sometimes they get a little dirty and they make it a little harder to read or actually be able to examine our subjects and our materials. So the important piece is always to make sure that your oil immersion lens is the last piece to be cleaned. Okay? So that's the big pieces that I want to touch on with a microscope. I think everyone knows how to use one at this point, knows how to carry it, knows how to put it away. So I'm not going to harp you with all of those big details, okay? We will do a worksheet in class where you will label a microscope. I will have all of the materials printed for you. You do not have to print anything. So now that we know how to use a microscope, let's talk about how we're going to do a microscopic urinalysis, or why we would do that. Now, last week we talked about doing chemical urinalysis and physical urinalysis. So we're going to go beyond that now. We're going to actually do a microscopic urinalysis. So what that means is we're going to take a sample of urine and we're going to spin it down in a centrifuge. And when we spin it down, what we're looking for are really those hard sediments in the bottom of your urine, the big pieces of your urine, essentially. And why we're doing it is so we can examine and count and categorize those solid materials that are found in our urine. So we're going to centrifuge down our urine, and when we centrifuge down, what's going to happen is it's going to separate. The hard materials will fall to the bottom, and the liquid portion will come to the top. Okay? The liquid portion we don't want. We're not going to do anything with that. What we want is down at the bottom of that centrifuge tube. That's called sediment. That's what we're actually going to be looking at. That's what we're going to put under the microscope. And we're actually going to stain that, so that way when we look at it under the microscope, we can see things in a brighter fashion. Okay, it's not going to be hidden on us. When we look at things under a microscope for urinalysis and a microscopic urinalysis, there's going to be several things that we're going to look at. Okay, so we can find in there, we can find cells. So we can find your red blood cells, your white blood cells, or your epithelial cells. We can also find casts. And what casts are, they're sediment built up to look. They all look very different. So I'm going to advise you to take a look in your book prior to coming to class so you know what the different casts look like. We could also find crystals. So they could be acid-based crystals, they could be alkaline-based crystals, or they could be abnormal crystals. So make sure you take a look at those as well. There's great pictures in your books of what those crystals will look like. And then we may find some other things. We may find some bacteria. We may find yeast. We may find parasites or sperm or mucus. We could find other artifacts. So there's a lot of different things and items we could find in a microscopic urinalysis. Now, your job as a medical assistant will be to actually set it up on the microscope, get the adjustments set so that way the doctor can be able to come in and actually read what is on that microscope slide, okay? And the final piece for this week that we're going to be dealing with is doing a pregnancy test. Now, most of us are mothers. We understand how to do a pregnancy test at home, and that's great. In the office, though, in the medical setting, it's a little bit different. Same process, though, we're still looking for the HCG hormone, and that's going to be the true detector whether or not you're pregnant. Now, that HCG hormone could be found in either your blood or your urine, and the thing that a lot of people don't know is it really can be detected 1 to 5 days after conception. The best time to find it and the most noticeable is when it hits its peak, and the HCG hits its peak at either between day 15 and day 18 of pregnancy. After that, what happens is it starts to actually decline and go down. And it will stay low at a very low level until the baby is born, and then it will disappear from your body. The best way to catch it, again, is when it's at that peak, at that 15th or 18th day, because that's when it's going to be at its highest. Okay? Not saying that you couldn't still find it, 20 days in, 30 days in. You can still find it. It's just not as predominant as it is in day 15 or 18. Okay? Now, doing a pregnancy test in the lab or in the medical facility, that's considered a CLIA waived exam. So it means that you can do it in an office. And it's a little bit different than how it is at home. You actually put the urine onto the cassette and you get a positive or negative answer. Same as you do at home, it's just on a different cassette than it would be if you were to take a home pregnancy. And you can also do it as a blood test. The first morning specimen is really what we're going to want for that test, because it's the one that's going to be the most concentrated with that HCG hormone. But the other part of it is you want to look at the specific gravity of the urine, because if the specific gravity is too low and the urine is very diluted, it could give you a false positive, which actually will start to make people get very confused and throw off our mothers, and we don't want to do that to them. They're already in enough panic because now they're pregnant. Alright guys, that is really the breakdown that I have for you on our labs this week. Please don't forget that this week you do have 2 discussion posts. One is based off of your diversity project, and one is based off of the first morning sample. So both of those are going to be due on Wednesday at midnight, and that means that you will have 4 responses this week, 2 for diversity project, 2 for first morning specimen. So please make sure that you get those both completed, all 4 completed by Saturday at midnight. This week you also have your resume, your resume rough draft that is going to be due. You can actually see online, I put up a rubric for you guys so you know what to expect and what I'm looking for in regards to your resume. So please follow that rubric so that way you get the best possible grade on this assignment. And also on Sunday, your quiz will be due. Now, we will do a quiz review in class like we always have for all of our other classes, so don't be afraid. I'm going to make sure that you are 100% prepared for this quiz. Alright guys, I look forward to seeing everyone on Thursday, and have a wonderful week. Goodbye.